Today our presentation is about reducing infant mortality rates. My name is Isabella.
I'm Maddie.
And I'm Allie.
And we are Purdue Northwest nursing students and also certified nursing assistants. Our target audience today of our presentation is new mothers.
So first, for an introduction. Sudden unexplained infant death is a condition where the cause of death cannot be explained even after an autopsy, a review of medical history, and an examination of the place of death are completed. This occurs in infants younger than 12 months and is the leading cause of death in the U.S. for infants. There are about 20,000 infant deaths per year, and 3,400 of them are related to SIDS alone. 90% of these cases occur within the first 6 months of life, especially between the first 2 and 4 months. This is unfortunately a very prevalent issue. Next, for importance. The Healthy People 2030 website shows a decline in infant death rates over the past years. Starting back in 2017, there were 5.8 deaths per 1,000 live births. That number has continually declined over the years, but has stayed at a steady rate of 5.4 deaths per 1,000 live births since 2020. These numbers are still high due to the lack of knowledge that surrounds safe practices for infants. Throughout this presentation, our goal is to educate and inform you all about the importance of preventative measures in reducing infant mortality. Also, infant mortality rates are an indicator of how well a society's overall health is because factors like healthcare access, social well-being, and economics impact the entire population. So now we're going to dive into some causes of infant mortality. First is unsafe sleep. There are many unsafe sleep habits that can increase an infant's risk of experiencing sudden infant death. First is sleeping on the stomach or the side rather than their back could cause the infant to have trouble breathing. They could roll over and suffocate. Sleeping on a soft surface like a fluffy comforter, waterbed, or soft mattress can block their airway. Sharing beds with parents, siblings, or pets can be harmful due to the fact that the other person could roll over them or they could become entangled in the sheets. Instead, it's suggested that the infant sleeps in a bassinet or crib in the same room with the parents. Finally, overheating due to overdressing or using too many blankets increases the chance of death. It's recommended to not have the baby sleep with a blanket at all and to use tight-fitting pajamas or a zippered sleep sack. So what is SIDS? It stands for Sudden Infant Death Syndrome, which is the unexplained death of an infant less than a year who appears seemingly healthy. This usually occurs during sleep. The exact cause is unknown, but is believed to be from a variety of risk factors, including brainstem abnormalities. There are many other risk factors for SIDS as well. One is that SIDS usually occurs more so in boys than girls. If there is a family history of SIDS occurrences, it increases the risk. Finally, during the colder months, SIDS cases increase, possibly due to a high prevalence of respiratory infections that can lead to breathing problems.
All right, and then we have a video to show you. Get the sound on.
Very energetic bundle of, my name is Marcellus Long. I'm here to speak about my son, Kyrie Cruz Long, who me and my wife lost due to SIDS February 15, 2021. Kyrie was a very energetic bundle of joy. That morning, my wife woke me up to the alarming sight and the news that our son was cold and was unresponsive. There was a lot of panic. There was a lot of confusion. I really was thinking that this was a bad dream.
We lose 3 babies every week in Georgia because of sleep-related deaths. Babies who are African American are about 2 times more likely to die from sleep-related deaths than white babies. And we think that's related to socioeconomics, access to healthcare, cultural practices and expectations that have been handed down.
Me having been a father of 5, I have never heard the conversation of SIDS. I have never heard an educator or anybody come and talk about the preventions, the proper way to lay a child down. I don't want another parent to have to go through what me and my wife went through. And I don't want to have to hear about a child being lost.
These are healthy, thriving babies that parents put to sleep and they never wake up. And that is devastating. But it's preventable if we follow the best practices when it comes to safe sleep. The ABCs of safe sleep are a great way for families to quickly remember how to keep their infants safe. So the A stands for alone. The baby should sleep alone in their own bed or crib, without any brothers or sisters, including twins or triplets, and they shouldn't be on an adult bed or sharing a bed with a parent. The B stands for on their back. Babies that sleep on their tummies are twice as likely to die from SIDS. And finally, they should be in a clear crib, a crib that doesn't have any stuffed animals, any blankets, just a fitted sheet and the baby. I am so grateful that people like Marcellus are willing to share their stories, because often we think this can't happen to us. It can't happen to our baby. And so when folks come forward and share their devastating stories, it really helps others in the community to recognize that, yes, it can happen, but we are not powerless. There are things that we can do to keep our babies safe.
I want to make sure as many people as possible can hear this story, because Kyrie's legacy, his story, his life, who he was, he is going to make sure that babies have a fighting chance in life.
And then birth defects are another cause of sudden unexplained infant death. They can have brainstem abnormalities, which is the breathing and arousal during sleep is controlled. Most of the time, this happens because a part of the brainstem is abnormally developed, leading to hypoxia. Genetic conditions can play a small role, but environmental factors have also been considered for sudden infant death syndrome. If an infant has a genetic disorder that affects cardiac condition or metabolism, such as a long QT syndrome and Brugada syndrome, infant death is likely. Premature birth, also known as being born 37 weeks before, and also low birth weight, 6 pounds or less, or being part of multiple birth is also a cause, because the organs are underdeveloped, especially the brain. Those who are premature or with a low weight are 4 times more likely at risk for sudden infant death. And then some risk factors. So low and middle income areas have 3 times the cases of infant mortality than in high income areas, due to poor access to prenatal care, increased prevalence of smoking and drug use, and unsafe sleeping environment. Infant mortality cases are higher in Asia, Africa, and Afghanistan. It is more likely for these areas to experience other complications on top of infant mortality, such as HIV, TB, chronic illness, injury, and violence. In areas where healthcare access isn't as easily accessible to everyone, it makes it hard to catch any potential problems that could be discovered during pregnancy, and to receive the proper care and nutrition the baby needs. Finally, those that are African American and American Indian descent are at the highest risk of sudden infant death. Maternal substance use during pregnancy increases the risk of sudden infant death, along with unsafe sleep practices. The American Academy of Pediatrics published a case study conducted in 2024 that focused on 2010 infants who experienced sleep-related deaths. 283, or 14% of these infants, were prenatally exposed to substances ranging from cigarettes, cocaine, marijuana, or alcohol. These infants who are prenatally exposed often have low birth rate, defects, or can be born prematurely or experience death. Most substance use cases also had a strong correlation between the substance exposure and vulnerability factors such as insurance, healthcare borders, and intimate partner violence.
Okay, so now we're going to talk about prevention. So early and regular prenatal care, including regular visits, ultrasounds, lab tests, screenings, and education, are all effective for reducing the risk for SIDS. Having a proper diet rich in calcium and vitamin D for bone health, iron for red blood cell production, and protein for fetal growth and development are all important. Taking prenatal vitamins are also recommended, but it's important to consult with your doctor first. Avoid alcohol, drugs, and excess caffeine, which can all harm the developing fetus. Frequent medical checkups are important to detect any abnormality that could put the baby at risk for sudden death. And there is no definite way to prevent SIDS, but there are safe practices that can help the infant to be safer. Placing your baby on their back to sleep is important, especially for the first year of life. Once the baby can roll over both ways without any help, they aren't required to stay on their back the entire time. You can use the stomach position when the baby and parent are in the same room and are both awake. Short periods of tummy time help the baby to build muscle strength. Leaving the crib as bare as possible, so no pillows, fluffy toys, or stuffed animals in the crib is also important. Having these things can cause problems with breathing if your baby's face accidentally presses against them. Also, having a firm, flat mattress is important. You also want to keep your baby warm, but not too warm, so a sleep sack is a great option. Also, make sure to never cover your baby's head while sleeping. Pacifiers are also good because they keep the airway open during sleep, and it can discourage them turning onto their stomachs. Breastfeeding at least 6 months to a year has also reduced the risk, and then vaccines are also shown to reduce SIDS. Then we just have some final conclusions. So healthcare facilities have been implementing and evaluating evidence-based training to address prevention of sudden unexplained infant death and how to support vulnerable families. A research article done in 2023 conducted Eyes on the Baby training for healthcare workers and families. Parents' knowledge on sudden infant death went from 28 to 57%, while their confidence went from 71 to 97%. The healthcare workers' increase in knowledge went from 62 to 96%, and their confidence went from 85 to 100%. And the workers felt this should be a mandatory course for everyone in the workforce who has contact with families with babies to ensure everyone knows the preventative measures. As healthcare professionals, we can educate families on safe practices that we've discussed earlier and make sure to keep an eye open for babies in unsafe sleep environments. We can also advocate on families' behalf for equipment, housing, and support. And there are also many SIDS resources that are available online. The National Institute of Child Health and Human Development lists a lot of resources. Some include the Safe to Sleep campaign, which aims to raise awareness about sleep-related causes of infant death. March of Dimes provides education to support research on these infant problems. The American Academy of Pediatrics provides safety tips and how to reduce the risk for SIDS. And finally, if you or someone you know has lost a child to sudden infant death, healthcare professionals can connect families with support groups and listen to their anxieties and concerns. And then these are our references, and then we're passing around our flyer and brochure, which kind of summarizes all of the information from the presentation.
Thank you
Thank
so
you.
much. Thank you.